small section of the shaft of a long bone, and what we can see here very clearly are the osteons. The osteons are the cylindrical structures, and you can see they consist of rings of bone, what we call concentric lamellae, and in the middle of the osteon we can see a structure colored red. That's a blood vessel, and those blood vessels, you have arteries, veins, nerves and lymph vessels, are sitting in the central canal of the osteon. And so you have your rings of bone matrix, and then between the rings you have small canal, you have these tiny spaces, microscopic spaces called lacunae, which contain the osteocytes. And if you look carefully at this model, you'll see the canals radiating out from the lacunae, the canaliculi, which transport nutrients, gases and waste products between the cells and the blood supply in the central canal. Now, around the circumference of the bone, we have this tough layer of connective tissue called the periosteum. You can see it here. Under the periosteum, we have these lamellae, but they're not concentric. They are running around the circumference of the shaft of the bone, and they're called circumferential lamellae, to be distinguished from the concentric lamellae, which are found in the osteons. Now, this getting back to the sheath here, this periosteum, it has, as I said, it's a tough layer. It has a lot of fibrous tissue, and then the inside of this fibrous layer contains a lot of bone cells called osteoblasts. Osteoblasts are cells that produce new bone matrix, and they are found on the inner aspect of the periosteum, the osteoblasts. I mentioned to you just before that sitting in the lacunae you have osteocytes, which are mature bone cells that maintain the matrix. So this is the outside of the shaft of the compact bone, and then if we turn this around and have a look on this side, the side which is facing the medullary canal. So you have the medullary canal here, which is filled with yellow marrow, and we have some cancellous bone, and then you have an inner membrane here called the endosteum on the inner aspect. And then here you can see some yellow marrow filling in the spaces here, and of course you'd have a lot of yellow marrow in the medullary canal. Now, so this is looking at the osteons that have been cut in transverse section, and if we have a look on the side here, I'll just show you this here, we see what the osteons look like from the side view. You can see them arranged as parallel, as parallel layers, with the artery running up here in the central canal. So it's good to know what the osteons look like in cross-sectional view and also in longitudinal view. And then we also have the arteries joining from one osteon, one central canal, to the next central canal here. You can see running in these transverse canals. You can see that quite clearly here. So these vessels are all linked up together. So blood has a rich blood supply. It is not a dead, lifeless tissue that some people think that it is. It's a dynamic tissue with a very rich blood supply. So that's just a little overview of the structure of what we call compact bone, where you find the osteons or Herversian systems. Great.